Oh my God. Colleagues from the media, both national media as well as foreign media, teman-teman, pada hari ini saya akan melakukan presentasi. Banyak sekali media dari luar negeri yang
given that we have
sementara Pak Doni Monando akan menyampaikannya dalam bahasa Indonesia. Colleagues from media, first of all, thank you very much for joining the virtual press briefing today. I do hope that all of you are well. I plan to conduct this briefing on a more regular basis and or as necessary to share with you the current policies taken by the government and progress of their implementation in our fight against COVID-19. I take a thematic approach for the briefing, while the daily briefing still will be done by the spokesperson of the National Task Force for COVID-19. There will always be one minister or representative of authority that will join me in the briefing. The theme for today's press briefing is progress of the government measures in addressing COVID-19 and international cooperation. This is why today I have with me here Pak Doni Monando, the chairman of the National Task Force for the Acceleration of COVID-19 Mitigation. He is one of the busiest officials in Indonesia right now, so I'm very lucky to have him today. Also present here today is Professor Wiku Adhisasmito, Chair of the expert team of the National Task Force for the Acceleration of COVID-19 Mitigation. While Pak Doni will focus on the policy of the government to fight COVID-19 and the way forward, my part is to share with you, among others, issues related to the magnitude of the current challenges and how we scale up the international cooperation. Colleagues, allow me to start by conveying my first point on the challenges we face. We are all living in uncharted waters. Never before have we encountered a public health crisis of such magnitude. The challenges faced by every country, with no exception, are immense and unprecedented. Indeed, these challenges have forced us to take the extra mile to effectively deal with our own domestic needs and situation. Every country has its own policies and measures to suppress the spread of COVID-19. However, one thing is for sure, there is no one-size-fits-all formula. In addressing the magnitude of the challenges, there is no assurances that the policy in one country can be only replicated or applicable in other. But at the same time, it is also very important for us to learn from the experiences of others, best practices, and or even the shortcomings. The government of Indonesia will spare no effort to scale up, I would like to repeat, to scale up its effort to fight the virus. Every day, we evaluate our policies, try to make them implementable, and give more impact in our fights against the virus. It is not easy, of course, but we will continue to do so. A multi-stakeholders, multi-sectoral, whole of government, and a whole of nation approaches are pursued with maximum effort. Policies adopted by governments are always based on relevant and unique characteristics of a country, whether it's culture, demographic condition, or economy. Colleagues from the media, my second point is about the international cooperation. I do believe that we will only win the war against the pandemic as well as the economic downturn by strengthening solidarity and cooperation. To effectively deal with COVID-19, I believe that we should not lose sight of the long-term perspective, which call for strengthening international cooperation to help bring our lives back to normal. With this in mind, Indonesia has co-initiated a UNGA resolution on the 2nd April 2020 on global solidarity to fight against COVID-19. That was the first UNGA resolution adopted virtually. I'm also happy that amidst this challenging situation, channel of communication between our leaders, among foreign ministers and other related ministers and authorities continue to be intensified by the day. I have never seen before such kind of intensive communication. From the communication I had so far, I see the spirit for cooperation remains high. And it is important that we nurture that spirit. This is the time for countries to work together and coordinate efforts to suppress further transmission of COVID-19 and overcome its ripple effects. So the main focus of Indonesia diplomacy right now is to ensure two main priorities. One is addressing the pandemic itself and mitigating economic impact. And second, protecting Indonesian citizens abroad as well as foreign nationals in Indonesia. So I would like to start with the priority of diplomacy number one, that is addressing the pandemic itself and mitigating economic impact. Indonesia consistently want to ensure that our containment measure in restricting the movement of people will not disrupt global trade and supply chain, including medical goods and medicines. Like other countries, Indonesia and the world in general is facing shortages in various medical supplies. In this connection, collaboration with other countries is not just necessary, but it is a must. Allow me to explain what we are doing bilaterally, regionally, as well as internationally. Bilaterally, we try to explore more innovative ways by enhancing cooperation between countries with raw materials, for example, with countries with technologies and human resources capacity. Two good examples, Indonesia and ROK, as well as Indonesia and Japan, are now having practical joint production scheme for medical supplies such as PPEs. Indonesia appreciates cooperation rendered by 9 countries, 55 NGOs, and 8 international organizations in the provision of masks, rapid tests, kits, and PPEs. Still need PPEs, ventilators, RT-PCR, reagents, thermometer, and VTMs. I have had intensive communication with many foreign ministers, and I will continue to do so. At the regional and international level, in the past few weeks, more leaders join hands through virtual international conferences to coordinate collective effort against COVID-19. To mention a few, the G20 extraordinary G20 Leaders Summit, which took place 26 March 2020. The ASEAN Special Summit and ASEAN +3 Special Summit just 2 days ago on the 14th of April 2020. Indonesia was among those who proposed the summit. The COVID-19 International Coordination Group, in which I joined through a weekly teleconference with foreign ministers, a number of foreign ministers. The OIC Steering Committee on Health, in which Indonesia is also a member, with which agreed to step up collaboration to confront COVID-19 in Islamic countries. And tonight, I will discuss the impact of COVID-19 on women with other women foreign ministers. On ASEAN Special Summit that I mentioned previously, President Joko Widodo's messages are crystal clear. The need for unity, synergy, and cooperation to effectively fight against COVID-19, ensure unhindered flow of goods in the region, especially food, medicine, and medical equipment, protect ASEAN citizens and migrant workers, ensuring the region continues to be the engine of global economic growth, as well as the anchor for regional resilience. Priority of diplomacy number 2 right now is protecting our citizens and foreign nationals in Indonesia. Our doors must be open for repatriation efforts. We need to make sure that mandatory health protocol in line with the WHO standards are complied with. The Ministry of Health of Indonesia has also issued a protocol for medical evacuation. Colleagues, my last point will touch briefly on government measure, and of course, Pak Doni will elaborate further. Ever since the first cases was detected in Indonesia in early March, our commitment to break the chain of infection is clear. Spearheaded by the National Task Force for Acceleration of COVID-19 Mitigation, Indonesia has actively and tirelessly enhanced its efforts related to COVID-19 to isolate, test, treat, and trace. From day to day, we continue to scale up our efforts and facilities to fight the virus. I want to repeat again. From day to day, we continue to scale up our efforts and facilities to fight the virus. Pak Doni Monardo will explain in more detail on this matter. So that is all from me. Now I would like to invite Pak Doni to take the floor. Pak Doni, kami persilahkan Pak Doni.
Assalamualaikum warahmatullahi wabarakatuh.
May peace be upon us all. Shalom, Om Swastiastu. Thank you, Madam Foreign Minister, for your comprehensive explanation on the global challenges and our efforts to continue to increase our efforts to fight the COVID-19 pandemic through international cooperation. Having explained before, and to complement the Minister's explanation, I will convey two things. That is the efforts and the undertakings that have been taken by the government, and also the steps that will be intensified by the Indonesian government to address the COVID-19 pandemic. Today, globally, 212 countries in the world have been affected by the COVID-19 outbreak. And this is a serious matter. They are transmitting at a higher rate and cause death to vulnerable groups for old people and also those with chronic disease. That means that this pandemic is becoming a problem for almost all countries in the world. This pandemic not only costs human lives, but also affect other sectors, particularly on economy, social, and political. At the initial months, the task force of COVID-19 have taken several measures on the aspects of the medical treatment. Among others, the acceleration of the provision of medical treatment, the acceleration of medical workers' needs, and also the acceleration of medical equipment and the distributions across Indonesia. The limited supply of medical professionals and facilities, we have overcome that with our virtual healthcare provision through the telemedicine program or the wall-less hospital by cooperating with several unicorns in medical cooperation, and we have the active patients of 15,000 people. The quality of our intensive care for patients with mild and hard symptoms have been referred to our referred hospitals. We will increase that. And has been said by the Foreign Minister that the government have designated 668 referral hospitals for COVID-19 across Indonesia, with the availability of dedicated isolation beds of 9,338 hospital beds. And the total of hospital beds in Indonesia is 324,494 beds. For patients with mild symptoms, we have prepared the emergency hospitals at Wisma Atlet with the capacity of 2,458 hospital beds, but we can increase that to 4,348 hospital beds and further increase in the future. We have also prepared 2 additional towers to deal with the COVID-19 patients. The Indonesian government, in this regard, the Ministry of Public Works have coordinated with several regions to increase the capacity of all hospitals in several provinces and also regencies in Indonesia. And in the span of 1 month, we have also manufactured isolation hospitals in Galang Island, which have been in active operations, which can have 790 hospital beds. To increase the support for curative functions, the task force have also involved medical volunteers and also internship doctors. And by 15 April 2020, the total of people is 223,472, with 4,401 are and 2,918 reserve doctors. And to maximize the provisions of medical equipment. We have always increased our synergy with involving all stakeholders, including experts and academics, and also researchers, private sectors, the state-owned enterprises, and also the community through increasing our own production capacity as well as international support. At this moment, we have distributed the assistance with the assistance of the armed forces and also the national police across Indonesia, among others, 729,000 personal protective equipment, 13 million surgical masks, 150 I would also like to underline the government's measures to produce the medical equipment independently. Several domestic industries, supported by the Indonesian Association of Textile Industry, have explored the solution for the making of personal protective equipment using local materials or 100% polyester. We are also testing the N95 mask using local raw materials with polyester and cotton, as well as the manufacturing of local ventilators that is currently conducted by the National Research Agency and also state-owned enterprises as well as national universities across Indonesia. Regarding the COVID-19 tests, I shall explain that the government have routinely said that the total of tests we have been conducting with swab PCR, and the swab PCR tests are the official number that we submit to the WHO. The target of the government is to carry out 10,000 swab PCR tests per day by activating 78 labs, whereby 44 have been in active operation. Of course, the government is also supporting other tests that have been conducted, such as the rapid tests that have been conducted in a massive rate by regional governments, hospitals, and also private sectors, which could be the initial screening to detect cases of COVID-19. The COVID-19 pandemic not only requires a medical treatments, but it also covers the political and social aspects that requires as much as attention from us that would accelerate the COVID-19. Therefore, we also increase the synergy and coordination between the government and also regional government in the implementation of the large-scale social distancing that is aimed to strike a balance between the medical to look at the potential for imported case, particularly in strategic places such as West Kalimantan, North Kalimantan, Bali, Riau, and also the province of Riau can be avoided. The health facilities have also continued to be intensified and has been done at Pulau Galang. The emergency hospitals that Galang Island have been operated and have cared for 39 people. That is, who are one of the crews of the KM Kelut ships. Regarding the protection for economic and social aspect, the government have allocated 405.1 trillion rupiah to prioritize in health and social security. Equally important is our efforts to mitigate new clusters of transmission through the mass exodus or mudik through the following measures. Then we have prohibited the armed forces personnel and also Indonesian National Police civil servants and also staff of state-owned enterprises and also those people who still have regular income. And mass exodus can only be done by people who have lost their job. And this is conducted in a very careful manner. And for those who return to their hometowns, we have made some efforts in our villages and also to the local community level to carry out the mandatory health protocols of 14 days self-isolation. And after the self-isolation period, we will carry out the labor-intensive programs, food security resilience in agricultural sector, animal husbandry, plantation, and also fisheries. And this is to address the warnings by WHO that there is a potential to create a food security crisis due to COVID-19 pandemic. Therefore, I would also like to highlight that all of these acceleration efforts requires the cooperation by all people and all of the strategies that we have used using the pentahelix approach or the community-based approach have been conveyed by the foreign minister, and this is the demonstration of Indonesia's gotong royong principles, and all elements of the public have an important role to carry out the education, socialization, and also to mitigate the further transmission clusters. Finally, I would like to state all the steps that we have taken to carry out the instruction of the President in mitigating the COVID-19 outbreak concerning two things: the acceleration of PCR testings across Indonesia, and also the increasing of transparency and also data provision, an accurate one and integrated one concerning COVID-19. With regards to the acceleration of PCR testing, I have mentioned before that the target of the government is to carry out 10,000 swab PCR tests per day by activating 78 labs, where 44 have been in active operation with the capacity of 8,800 tests per day. To increase the capacity of PCR tests in those labs, 18 PCR machines have been allocated in Jakarta, Banten, in West Java, in Lampung, South Sulawesi, Papua, South Sumatra, Bali, with a capacity of 25,000 per day, and it will be effectively in operation on the 6th of May. The semi-automatic rapid test PCR from Beijing Genomics Institute, with the capacity of carrying out 10,000 tests per day, has been allocated to be put at the Litbangkes at the Ministry of Health, which is hoped to be in operation in the next 2 weeks. To increase the accuracy and also the data transparency, the National Task Force of COVID-19 have also established and operationalized an integrated platform to integrate all the data from the local health facilities, hospitals, and also the Office of the Health in the regional and also the provincial level. And the integrated platform have covered 900 local health facilities in Indonesia through online. And at this moment, the COVID-19 confirmed cases in Indonesia is 5,136 and 446 recovery, 469 deaths. We hope that in the future, we can continue our preventive measures. May peace be upon us.
Well, thank you very much, Pak Doni, colleagues. Now we move on to the question and answer session. We have received many questions from various media. I see questions from Mainichi, Reuters, New York Times, Sky News, The Economist, Al Jazeera, Taiwan Central News Agency, Xinhua, Anadolu, Nikkei, People's Daily, and VNA. To effectively make use of the time, I have clustered the question into 4 main issues. The first issue is on the data and statistics. The second is on testing, treating, and medical supplies. And the third issue is on the social restriction measures. And the fourth issue is on the international cooperation. So the first until third issues will be later explained by Pak Doni as well as Professor Wiku. On my part, I will answer questions related to the international cooperation. And some of your question, the answer of some of your question have been mentioned during the presentation. So therefore, for me, I will not repeat them again. So now let me start with the fourth issue, the fourth cluster of the question that is related to the international cooperation. So let me start by mentioning again that Indonesia remains to be an ardent supporter and advocate of the spirit of solidarity, cooperation, and multilateralism. Indonesia so far has been working closely with the WHO, including on the implementation of international health regulation, or IHR, core capacities in the state parties. Allow me also to re-emphasize a few basic principles. First, to address COVID-19 challenge, there is no one-fits-all formula. That is why policies developed by the Indonesian government have and will always reflect the characteristic situation of Indonesia and its people. Pak Doni has mentioned some example of this approach. Exchange of information, best practices, joint collaboration on development of medical supplies are key. We have also to make sure that medicine and vaccines, once they are available, are equally accessible to all countries. Second basic principle, the policies developed are temporary in nature. I repeat, the policies developed are temporary in nature. Some question asks, when will we lift the travel restriction? The answer is, it will depend on the development of the situation. Our priority now is to break the chain of the outbreak and to prevent the rise of the COVID-19 cases, including the potential of imported cases. That is why our focus has been on restricting the movement of people, but again, not restriction for the movement of goods and flows of goods. I hope that makes my message very clear. Now I will address questions related to ASEAN and bilateral relation. On ASEAN cooperation, from the very beginning, ASEAN commitment to jointly address COVID-19 has been steadfast. We already had the ASEAN Coordinating Council, or we call it ACC, and the ASEAN-China Ministerial Meeting since mid-February 2020. Other meetings were also held to discuss collective effort to fight the virus. Among others, ASEAN Health Ministers Meeting and ASEAN +3 Health Ministers Meeting on 7 April 2020, and then ASEAN Coordinating Council Meeting. Again, we met in the context of ACC on the 9th of April, and then Special ASEAN Summit and Special ASEAN +3 Summit on the 14th of April that I had mentioned before. In ASEAN Special Summit, President Joko Widodo underlined the importance of strengthening unity, synergy, cooperation, collaboration in the fight against COVID-19. Indonesia also proposed standard operating procedure for cross-border public health response, such as contact tracing and outbreak investigation. Indonesia also prioritizes ASEAN cooperation on the protection of migrant workers within the ASEAN member states and ASEAN national in third countries. Meanwhile, during the ASEAN +3 Special Summit, President Widodo called on this 21-year partnership to provide a platform for regional resilience. President proposed to strengthen regional cooperation, including in joint production of medical equipment, antiviral medicine, and vaccine, capacity building for medical personnel under the EPT Field Epidemiology Training Network Framework. In addition, to prevent future pandemic, Indonesia specifically proposed to establish an EPT task force on pandemic in order to recommend comprehensive measures to strengthen resilience in the EPT region to face future pandemic. And as part of the task force, the President of Indonesia also proposed cooperation between pharmaceutical and drug industries in the EPT member countries, including pharmaceutical state-owned enterprises. Indonesia supported the establishment of COVID-19 ASEAN Response Fund. This fund is intended to support effort of detection, prevention, support medical workers and medical equipment, and also to support research and development of vaccine and other medicine. To mitigate and address the socio-economic impact of COVID-19, Indonesia proposed during the ASEAN +3 Summit to activate ASEAN +3 existing mechanisms, such as ASEAN +3 Emergency Rice Reserve, ASEAN +3 Microeconomic Research Office, and the Chiang Mai Initiative Multilateralization. Colleagues, on the bilateral cooperation, because we received questions from you about the bilateral cooperation, we have, as I mentioned to you before, we have cooperation with many countries. And again, I would like to reiterate that we should not lose sight of the long-term perspective in dealing with COVID-19, that cooperation and collaboration will be the key to bring back our lives to normal. Indonesia continued to promote cooperation and collaboration, not only with partner countries, but also with private sectors, NGOs, and international organizations. I also had mentioned it before in my presentation. I mentioned about 2 examples of practical joint production scheme with Japan, with ROK. With Turkey, for example, I do hope that the government of Turkey could render its facilitation to enable Indonesia to import raw materials needed to produce medical equipment. And I could not mention one by one, but in short, we are enjoying, or we are always trying to develop, to enhance our cooperation
by the president, and when do you think it will be implemented, and what is the integration with the serological test? As I've mentioned, that the efforts will continue to be done. We will always increase our capacity as well as to increase the resources available for this. Until the 6th of May, we hope that no less than 40,000 tests per day we can carry out. On the third question, how many personal protective equipments that have been distributed to medical workers, and what are the steps taken by the government to increase protection to health workers? We highlight here that the distribution of PPEs to across Indonesia have been assisted by Indonesian Armed Forces airplanes and also by the armed forces in each regions, and the numbers that have been distributed, 731,000 PPEs, and we will continue to increase this in accordance with our capacity, 13 million surgical masks, 150,000 N95 face masks, and 800,000 rapid test equipment. In addition, we also have to convey that all of the health workers and doctors involved directly or indirectly, we will make sure that they have to wear the PPEs because several cases that have happened. Some of the doctors, our frontline heroes in our battle against COVID-19, there are 5 of them have been, 5 of the dentists have died, and 3 throat, nose, and ear specialists, and that is the priority of the National Task Force to ensure that all doctors, both directly involved and those who don't, must wear PPEs. And we have also assisted in distributing 5,000 PPEs to the Indonesian Doctors Association, the Indonesian Dentists Association, and 2,000 to the throat, nose, and ear specialists, and 5,000 to Indonesian GP Association. And we will continue to increase this if we can increase our production capacity domestically. And on the questions from Reuters and Al Jazeera, why the government merely appeal and not firmly prohibiting the mass exodus given the high risk of transmission? I shall highlight that the president have prohibited the mass exodus, but there's one problem that we encounter. How about those people who have lost their jobs entirely, and those who have been made redundant, and those who cannot have livelihood to sustain their life for the next 3 to 6 months? And we have to think about them, because if they are to remain in the capital city, it's almost impossible for them to have a sustenance. Therefore, if we cannot provide or to return them to their hometowns, and with the coordination with the regional heads in each regions, therefore it will be very helpful. One of our efforts is to increase or encourage people to increase their immunity, and one of the things that we encourage is to consume healthy foods. And for those people who have lost their jobs, it will be difficult for them to obtain that in the capital city or in big cities. But if they have returned to their home country or to their hometowns, they will be able to obtain that because they have their own agriculture, they have their own plantation, and also husbandry. This will provide a good sustenance for them. On the next question, the large-scale social distancing that is perceived to be lax, is it because of the more priority on economy? I shall highlight once again that the government and the president is very serious in carrying out efforts to maintain the health of the people, to protect our citizens. We have to work hard so that all the healthy people, they remain healthy. And for those who aren't healthy, we treat them to become healthy. And for those who are unhealthy, we are having to treat them. And our first priority is to prioritize on the several approaches, such as sociological approaches, so that we can carry out these prevention measures. Next, I will invite the Professor Wiku, or the expert team from the National Task Force, to complement the answers to the questions.
Good afternoon. Thank you, Ibu Retno Marsudi, our Minister of Foreign Affairs, for this opportunity to address specific issues, the international media and all countries that are fighting this COVID-19 pandemic. And thank you, Pak Doni Monardo, the Chairman of the National Task Force, for the acceleration for COVID-19 mitigation. I'm here to elaborate the technical details to overcome certain issues regarding the challenges that we are currently facing. First, there is a question from the Mainichi. Why Indonesian government doesn't announce positive cases, basic details such as sex, age, and connection between each cases? As instructed by the President of the Republic of Indonesia, that we have to open the data, and we are now integrating the data in the task force of COVID-19, and we are working very hard to make sure that the data integration from all level in Indonesia, from district level, provincial level, and national level, integrated and synchronized to improve the validity of the data. As soon as we have all of the data integrated and valid, we will be informing the public on the situations about the cases in Indonesia. We are having the web-based platform called Bersatu Lawan COVID-19, whereby this platform enabled all of the stakeholders at all levels in Indonesia to put in the data and validating the data so that we will have a synchronized data that will be published to the public. The second question is related to whether the task force has an estimation when the peak of the cases in Indonesia will be reached. This is from Mainachi and also New York Times. The predictions of the cases usually done by experts, predictors, who are coming from different groups, scientific institutions, and individuals. And we have reviewed and combined all of the predictions, and we believe that the peak of the pandemic in Indonesia will start at the beginning of May and will last around the beginning of June, where the number of the case during the peak cumulative is 95,000, whereas during June and July, the confirmed cases cumulative will be reaching 106,000. However, we have to understand that in the projections, that's not a rigid number. We are having a collective effort really to implement the policy to make sure that the predictions remain the predictions and the real case should be lower than the predictions. Therefore, we respect to the numbers. However, we always working hard to make sure that the peak will not be reached. The third questions ask about the statement of the reported cases in Indonesia is only 2% from the actual number comes from the Center of Mathematical Modeling of Infectious Disease, London, UK. I would like to say that all of the modelers that have been incorporated into our groups, which are coming from Harvard University, from Imperial College of London, from University College of London, from NTU, from University of Indonesia, and all other experts, all of those modelers, including the mathematicians, they are using the same formula, which is SEIR, which is susceptible, exposed, infected, and recovered. And we believe with the number and assumptions, we know that the projected cases have some numbers. However, with using that numbers, we are developing the policy to make sure those projections will not come to reality. Also, there is questions from the economist asking about, after receiving 20 units of PCR early April, what is the next plan? So we are opening collaborations from all parties, international and national, that would like to donate or collaborate with us on the PCR. And then also, we are making sure that all of the equipments will be placed in the laboratories across Indonesia and fulfill all of the laboratories which don't have the facilities, but they do have the human resources to handle the laboratories using the RT-PCR. Lastly, there is a questions about how many provinces will receive the RT-PCR machines from Roche. I would like to mention there are 12 provinces that will be receiving the RT-PCR machines. That is Jakarta, Banten, West Java, Central Java, East Java, North Sulawesi, Lampung, East Kalimantan, South Sulawesi, Papua, South Sumatra, and Bali. I think those are the questions that have been addressed to us, and we have been trying to respond to those questions. And next, I would like to give this to the Minister of Foreign Affairs. Thank you.
Well, thank you very much, Pak Doni. Thank you very much, Prof. Wiku, for the presentation, as well as for answering the question, and also for joining the briefing today. So colleagues from the media, so once again, thank you very much for joining me, Pak Doni, and Prof. Wiku in this press briefing. And see you next time. So don't forget, stay healthy, stay strong, and stay united. Thank you very much. See you next time.